Thanks very much for joining us again today. As usual, I will give the daily statistics for COVID. I can report that the total number of positive cases yesterday was 1,429. That represents 16.4% of people newly tested. The total number of positive cases now is 42,685. 537 of the new cases are in Greater Glasgow and Clyde, 327 in Lanarkshire, 239 in Lothian and 92 in Ayrshire and Arran. The remaining cases were spread across the eight other Health Board regions. Only Orkney and the Western Isles did not have new cases reported yesterday. I can also confirm that 570 people are currently in hospital, which is an increase of 43 on the number I reported yesterday, and 49 people are currently in intensive care. That's 14 more than yesterday. I'm also very sad to report that in the past 24 hours, 15 deaths were registered of patients who first tested positive over the previous 28 days. That means that the total number of deaths under the measurement we use for the daily figures is now 2,572. Now, confidentiality means that I can't ever go into detail about the people behind the statistics I report every day. But I do want to point out this to you today. Half of the 15 deaths that I have just reported are of people under the age of 80, and a small number of them are of people under the age of 60. Please do not ever think that this virus only poses a risk to the lives of the very elderly. It poses a risk to all of us, and I'm asking everybody again to take and treat that risk extremely seriously. I can also report that National Records of Scotland has just published its weekly update that, as you will recall, includes cases where COVID is a suspected or contributory cause of death. Today's update shows that by last Sunday, the total number of registered deaths linked to COVID under that wider definition was 4,301. 25 of those were registered last week, which is 5 more than in the week previously. 17 of the 25 deaths occurred in hospital, 7 and 1 in a home or other non-institutional setting. Once again, I want to send my deepest condolences to all those who have lost a loved one to this virus throughout the course of the pandemic. And of course, that is particularly the case to those who have recently lost someone and who are currently in that very acute stage of grieving. Now, tomorrow, Parliament has to review the restrictions we imposed on household visits 3 weeks ago. I'll cover that issue and others in a video statement to a virtual meeting of the Scottish Parliament tomorrow. As you might expect, we are unlikely, very unlikely, to announce any changes or easing of the current rules on household gatherings. I will, however, say a bit more to Parliament tomorrow about new rules on face coverings and about our options once the current 2-week period of additional restrictions ends on the 25th of October. For today, though, the main issue I want to highlight is travel. For many people, the October half-term is approaching, and indeed in some parts of Scotland it has already begun. So I want to highlight some general guidance on travel, and I am also going to provide one much more specific recommendation. The first piece of general guidance relates to the 5 health board areas in Scotland that currently have additional restrictions in place on hospitality because they have especially high rates of COVID just now. And to remind you, these areas are Lothian, Lanarkshire, Forth Valley, Ayrshire and Arran, and Greater Glasgow and Clyde. If you live in one of these 5 health board areas, we have already asked you not to travel unless you really need to. So not to leave your health board area unless it is really necessary. And we've also asked people from the rest of Scotland not to travel to any of these 5 Central Belt areas unless they really need to. As I said last week, this guidance does not stop you from taking an October half-term break if you have already booked it and you don't want to cancel. Though if you are taking such a break or if you are already on such a break, please be very careful and please follow all of the rules while you are there. But this guidance is intended, very firmly intended, which is why I'm putting so much stress on it today, to minimise travel as much as possible between the Central Belt and other areas of Scotland. So please ask yourself how necessary your journey is before deciding, for example, to go on a day trip to another part of the country. In fact, my general advice for everyone at the moment across the country is to think very carefully about whether you need to travel at all. And if you must travel, if your trip is necessary, then travel carefully and safely. For example, make sure you wear a face covering on public transport. That is the law at the moment. And also remember to physically distance from other passengers as much as you can and avoid car sharing if possible. The advice to think carefully before travelling is especially important in relation to areas with high rates of infection. And so, of course, that advice applies not just to travel to and from the central belt of Scotland and the more general advice I've just given to everybody, but it applies to travel to and from parts of England with high levels of infection. We're currently advising against non-essential travel to the parts of England which are classed as very high or high alert areas under England's new 3-tier system. And I'm asking people from these areas not to travel to Scotland either. Several of these areas are seeing even higher levels of infection than we are currently seeing in central Scotland. And we will make sure we keep the information on which areas are covered by this guidance updated on the Scottish Government website. But in addition to that general advice, there is a specific issue I want to cover today. And I take no pleasure in doing this, but it's important that I give this advice and make a very specific recommendation to you. Blackpool, a place that many Scots love and like to visit, particularly at this time of year. Many of us have happy childhood memories of going to see the Blackpool illuminations. But this is one of the places currently classed by the UK government as a high-risk area. And I need to advise you that trips to Blackpool are now associated with a large and growing number of COVID cases in Scotland. We indeed now have an incident management team in Scotland that has been set up to look specifically at cases associated with Blackpool. And I can tell you that in total in the last month, and these figures are rising just now, so the figure I'm about to give you will undoubtedly already be out of date. But the most up-to-date figure I can give you is that in the last month, around 180 people in Scotland with COVID reported that they had recently been in Blackpool. Now, let me be clear, that doesn't necessarily mean that they got COVID during their trip. As you heard us talk about in relation to hospitality, it's not possible to be absolutely certain where somebody actually picked up the virus. But Blackpool is being mentioned in test and protect conversations far more than any other location outside of Scotland. And to take the past week in more detail, 344 people who have spoken to test and protect teams after contracting COVID reported some sort of travel outside of Scotland. 252 of those had travelled somewhere else in the UK. And of those 252, and remember this is in the last week alone, well over a third, 94 in total, had been in Blackpool. So my specific advice is this. If you were thinking about going to Blackpool and you haven't booked yet, then please do not go this year. Even more specifically, because we know this is an issue and I want to be very clear about this, do not travel to Blackpool this weekend to watch the Old Firm match in a pub. If you do that, you will be putting yourselves and you will be putting other people at risk. Please do not do that this weekend. And if you, otherwise not related to the football, have already booked a trip and you can't cancel it without cost and you're determined to go, then please think very carefully indeed about how you travel and what you do when you get there. For example, quite a lot of people who've contracted COVID and who have also been to Blackpool have travelled by coach. We understand that that is very common, particularly at this time of year. Now, again, that does not mean that they absolutely necessarily got the virus on the coach, because we can't be certain about that. But if you have to travel to Blackpool by coach, or if you travel by any form of public transport, then try to maintain physical distancing and make sure you wear your face covering throughout the journey. And once you arrive, and I know this is really difficult, don't spend much time indoors and don't, if you can avoid it, spend time in pubs and bars and other hospitality venues, because doing that significantly increases your chances of getting the virus. I know that many people look forward to trips generally, but to Blackpool in particular in the autumn, and that for some of you, and I know many people who fall into this category, it's almost an annual ritual. But I'm asking you, if you can avoid it, please do so this October. And if you do go there, if you have to go there, please be very careful. My last point on travel relates to a letter I received yesterday from the First Minister of Wales and is very relevant to what I've already been talking about. The First Minister of Wales is seeking agreement between the 4 UK nations on travel restrictions where necessary from high prevalence areas in one UK nation to lower prevalence areas in others. I want to be clear today that I back the calls from the First Minister of Wales, and I'll be writing to the Prime Minister today to seek urgent talks on that issue. I also support the First Minister of Wales' call for another COBRA meeting in early course to discuss collectively between the 4 nations what further steps we can all take at this stage to suppress the virus. Now, I've spoken at some length today about our guidance and recommendations on travel, and that is for a reason, because it is important, and restricting travel right now as much as we possibly can is another, I know, unwelcome but very important way in which we can all try to reduce and minimise the spread of the virus. But of course there are other important steps we must all take to reduce our own personal risk of getting the virus or of passing it on to others, including, if we are in the younger, healthier age groups ourselves, potentially passing it on to those who are much more vulnerable. So please do not visit each other's homes at the moment, except for the very specific exemptions for childcare or looking after a vulnerable person. Stay out of the homes of other families right now. This is our single most important way of stopping the virus jumping from one household to another. I know it is incredibly hard, but it is incredibly important. When you do meet outdoors or in a cafe, for example, which are allowed to stay open during the day to allow people somewhere that they can have contact with others, remember that the maximum group size is 6, and that should be from no more than 2 households. So that's the rule that applies outdoors or in any public indoor place. Only car share if it is essential, as I said earlier on, and if you must car share, wear a face covering and try to keep the windows open. Work from home if you can. That advice has never changed in Scotland, but this is an important moment to underline it. If it is at all possible to do so, work from home. And to employers across the country, please allow your workers to do that. Download the Protect Scotland app if you've not already done so. And finally, remember the rules that are encapsulated in facts. The difficult but fundamentally quite simple things we can all do to minimise the risk of transmission. Wear face coverings whenever you're out and about, but particularly in any enclosed spaces. Avoid places where crowds of people come together. Clean your hands obsessively if necessary, and clean hard surfaces after you touch them. Keep a 2-metre distance from people in other households when you are coming into contact with them, and self-isolate and book a test if you have any of the symptoms of COVID. And remember, yesterday, all of the information we gave about support for self-isolation, you can find that on the NHS Inform and Scottish Government websites. It is by following all of this advice and following all of these rules, however hard it is, and I know it is hard, that we will collectively help to suppress the virus again. We are, as I said yesterday, at a really critical moment again. Many countries across the world are. We see more and more countries now dealing with a second wave and having to impose new restrictions. We will not shy away as the Scottish Government from doing what we think is necessary to keep the people of Scotland as safe as possible. But every single one of us can play a part in this. Please follow all of these rules. Don't think it's okay just to breach them on the odd occasion, because the time you breach them may be the time the virus is close to you and will spread from you to somebody else or from somebody else to you. And the chain of transmission that could set off could result in you becoming somebody like the too many families across Scotland right now that are grieving the loss of a loved one. So I'm sorry to be so blunt with you, but I think it is important at this juncture not to shy away from these blunt messages and to ask everybody right now to rededicate themselves to this collective effort to keep COVID under control and to stop it taking lives unnecessarily or making people ill unnecessarily. Thank you for listening. The Chief Nursing Officer is going to say a word or two, as I indicated she would yesterday, about infection prevention in hospitals, and then she and I will take questions as normal from journalists.
Thank you, First Minister. Firstly, I want to applaud the incredible efforts of our health and social care staff on the front line and also in our supporting roles, who've been working tirelessly to care for all their patients in this unprecedented time. preventing the spread of infection, but in particular, preventing and limiting the spread of COVID-19 in our hospitals and in our care homes. People will know when there is a prevalence of infection in the community, such as the winter vomiting bug. This often spreads into our hospitals and other large institutions. So the same is then true for COVID-19. As we see numbers of infections of COVID-19 in the community rise, this raises the prospect of increased transmission within our hospitals and care homes. So I would urge visitors, staff and patients to be even more vigilant than usual. To support keeping our hospitals safe, our National Specialist Infection Prevention and Control Service works with health boards to proactively monitor COVID-19 incidents in hospitals, and boards themselves continue to implement a range of infection prevention and control measures which minimise the transmission of all infections in hospital, however in particular at this time, COVID-19. So this includes managing outbreaks as well as providing specialist advice on what we are calling COVID and non-COVID pathways for patients so that clinical staff can deliver safe and effective care, whether it's in elective procedures or emergency procedures, whether people are coming in who have COVID or people who don't have COVID. So other measures which I want to focus on today relate to facts, which we're all now familiar with. In particular within our healthcare setting, physical distancing, hand hygiene and face coverings. We've issued guidance on these measures, which we constantly keep under review and update as global evidence and research evolves and gives us new advice and new evidence to make changes which people will have seen as we have gone along throughout this pandemic. In addition to this, new UK-wide infection prevention control remobilisation guidance for healthcare settings has been published. This has been implemented across our NHS in Scotland and outlines key COVID-19 measures such as the additional use of PPE over and above what would typically be expected, extending the use of face masks and face coverings, hand hygiene and physical distancing where at all possible within our healthcare settings. And obviously physical distancing within healthcare is not always possible for clinicians who are delivering care, but people should be expected to maintain that 2 metre distancing where possible, and will see the signs and signage within our settings, and I would urge everyone to stick to these. All of this guidance aligns with and complements our standard infection prevention practices which are in place across our National Health Service, from our outpatient clinics to our most complex area of care delivery such as intensive care. And finally, in September, the Scottish Government published updated guidance in the extended use of face masks. So what can visitors and patients expect to see in place to help keep them safe, on top of what would typically happen across our health and social care services, such as cleanliness standards, hand hygiene and general clinical practice? So staff providing direct care to individuals in healthcare environments will be wearing a surgical face mask at all times throughout their shift, rather than just for individual procedures where patients would be used to seeing that happen. Non-clinical staff members will also be wearing a surgical mask when they're entering an area where direct care, such as a ward, is undertaken. And finally, anyone visiting or attending a hospital, primary care premises or an adult care home needs to wear a face covering. On top of that, physical distancing, hand hygiene and limiting social interactions as much as possible will be in place across all of our settings. So these are the same measures that the First Minister has just outlined for across the country, and we need to see them within our health and social care services. And I believe at this time it's even more important that facts, as far as possible, is followed within our care delivery setting, as by following these guidelines, it leads to better outcomes for patients and for staff and gives us the best possible chance to prevent transmission of COVID-19 and protecting our NHS at this particularly challenging time. Thank you.
Okay, thank you, Fiona. We'll move now to questions. Chris McLaughlin from the BBC.
Thank you. Picking up on your travel point and in a football aspect in particular, Celtic take on Rangers this weekend in a stadium that holds 60,000 people. Now, with growing evidence that some fans will travel out of restricted areas to places like Blackpool, isn't there now an argument to say that fans would be safer inside stadia in a controlled environment? Or is there a trust issue with football fans? And separately, Northern Ireland just announced strict new rules, including school closures. It should not be doing the same, given evidence that the R number reduces so much more when schools are closed.
The argument, I think, Chris, about football is that it is much safer for everybody if football fans and the rest of us in the wider population obey the rules. And don't try to get round the rules, don't try to push them to breaking point, don't try to find the loopholes. These are rules not that I've just dreamt up to entertain myself. They are rules to keep us all safe, and nobody can listen to the numbers. I'm now standing here every day reading out again and be in any doubt that this is a serious situation that we all need to stay safe. So the conversation I shouldn't be having a conversation which is predicated on football supporters not behaving responsibly and therefore, having to contemplate other risky things in order to mitigate against even riskier things that they're prepared to do. Let's all obey the letter and the spirit of these rules. And I think the vast majority of football fans will do that. But for any that are sitting here right now, instead of thinking, how do I keep people around me safe, are thinking, how do I travel somewhere risky to get to a pub to watch the Old Firm, you're putting yourself at risk, and you're more importantly putting people around you at risk. Don't do it. Watch the football at home for this period and enjoy it, I hope, at home, but don't act in a way that is putting people at risk. And your question is about football, so I'm predicating my answer on football, but that applies to everybody. In the normal course of events, it is human nature, I guess, when there's rules in place that governments have put in place for whatever reason, to think about how you push them to the limits. Don't do that right now, because these rules are about saving lives and stopping people getting ill. We should all be thinking right now about how do I actually respect the rules, not to keep Nicola Sturgeon happy, but to save myself from getting COVID, or to save me from passing COVID on to an elderly or vulnerable relative who might die from it. That should be what we're all thinking about just now. And I appeal to people to bear all of that in mind. In terms of your second question about Northern Ireland, Northern Ireland have taken a number of decisions today, and the executive there is right to take the decisions that it feels are necessary to protect the population. We keep all of the restrictions that we have here under review, and as I said earlier on, I will not shy away from taking action that I think is necessary to protect the population. But I would point out that prevalence of the virus in Northern Ireland is about 2.5 times what it is in Scotland right now, so there is clearly an even more significant problem there. We have many of the restrictions announced in Northern Ireland today already in place in Scotland, or in parts of Scotland, particularly those around hospitality. Many of our schools are on holiday just now. Others will be on holiday next week. I desperately want to keep schools open because I think it is in the best interests of young people, and part of asking everybody else across the population to stay out of pubs, for example, and football supporters not to travel to Carlisle or Blackpool to go to the pub because they can't do it in Glasgow, is about all of us trying to act in a way that keeps the virus at a level that allows schools to stay open. And that, I think, should be a really important objective for all of us. But generally, we keep all of this under review. And as I think I've made clear, not just in my words, but in my actions, if I think anything is necessary to protect people from this virus, then I won't hesitate to do it. Ross Govins from STV.
Afternoon, First Minister. On travel, how close are you to enforcing a travel ban for certain parts of the country? How would you do that? Or are you simply going to have to rely on people's goodwill and them to listen to you?
Goodwill and people being responsible have got us a long way over the past 8 months, and let's not forget that. Goodwill and people doing the right thing for the right reasons got us to a point where we had suppressed this virus to very low levels. Inevitably, as we go into winter now, a lockdown, that challenge grows again. But it is people's good sense and goodwill and sense of solidarity with each other that I think should still guide us through this. I made a comment earlier on about football that I would make more generally. I'm not expecting you to obey these rules just because I stand here and ask you to, although, I'm not arguing with that if that's what you want to do. I'm asking you to obey these rules because they are about keeping you and your loved ones safe and keeping the whole country safe. We should all be doing this for the right reason. On the specific about travel restrictions, if we think putting formal travel restrictions in place is necessary, we will do that. And I don't rule that out. I don't rule anything out. But obviously, the police cannot stop everybody on the roads to check whether they're travelling for essential purposes. So there is always going to be around this enforcement on a whole range of these aspects may have a part to play. But ultimately, we're going to succeed or fail in this by what we all do voluntarily for the right reasons. And, this is the moment that, more so than at any other point since the spring of this year, it really matters for everybody to sit up, take notice and remind themselves of what this is all about. It is about protecting the NHS and fundamentally it's about saving lives. And I know it's frustrating that this October holiday we might not be able to do all of the things we love doing. At the weekend we can't go to the pub or a restaurant. I know all of that is deeply frustrating, but if that stops people dying, then I think that's a price worth paying right now. And when we get through this, because we will get through it, and we go back to enjoying all of these things again, then we'll be able to do so with fewer of us having either died from this virus or suffering long-term health consequences of it. So my appeal to people now, more than at any time since the spring, is please do all of these things for the right reasons, and let's all look out for ourselves and each other. Peter Smith from ITN.
Good afternoon, First Minister. My colleagues at STV and Ipsos Mori have released a poll today just out actually showing record high levels of support for independence. It's now up to 58%. Now, I know you don't want to use the platform here to make political points, but many of the reasons for people surging this surging support is being pegged to your performance in this pandemic, your communication strategy, your use of devolved powers. People have clearly seen what you've been able to do and have been impressed by it. I just wonder, from looking at this and looking ahead at some of your frustrations on furlough and the levers that you don't have access to navigate through this pandemic, what do you think the people of Scotland are telling Boris Johnson, and what message would you send to the Prime Minister?
Look, my responsibility is to continue to do everything I can to steer the country through a pandemic. I've seen the headlines of the poll. I'm not going to comment on an opinion poll at this briefing. I think it would be wrong to do so. But I think what the people of Scotland want from me is leadership, clear and frank leadership about the challenges that we face right now. They want me to, I think, take firm decisions, even if those decisions are unpopular, and not to shy away from the tough decisions. And that's what I will try to do. I think they also want leaders, me and other leaders across the UK, to be frank about the things we get wrong. I have got things wrong in this pandemic. I will get things wrong in future. I am not infallible. But the reason I stand here every day is to try to share with you the factors that we have to weigh up, the processes that lead to our decisions and the reasons for those decisions, and be frank where we get things wrong. That's what I'm going to continue to do. I am a politician, and nobody would believe me if I stood here and said I didn't pay any attention to opinion polls. I'm a politician, but you know what? Right now, I trade away approval ratings to get rid of COVID. This has changed the perspective of so many of us over these past few months, and that includes me. The things that would have excited me a year ago or worried and depressed me a year ago, just I see in so much more perspective. Nothing else matters to me right now than taking the hard, necessary decisions that I need to take to get the country through this challenging period as well as I possibly can. And that's what I'll continue to stay focused on every day, for every minute of every day, for as long as it takes.
You mentioned frustration, people being frustrated with perhaps the lack of clarity. Are you frustrated with the lack of clarity from the Prime Minister?
I'm responsible for the decisions I take and trying to give as much clarity about them as I can, and also trying to be honest, as I was with you when you asked me a question perfectly legitimately last week about why sometimes trade-offs we're making to give people as much flexibility as possible sometimes lead to what appears to be a lack of clarity. That's what I'm responsible for. Other leaders have to be responsible for themselves. I think the more we can talk across the four nations and come to agreements on the things that need four-nation agreement. I've been honest about one of those today on the back of the First Minister of Wales, who's not somebody who supports independence for Wales, so it's not a constitutional point. But the issues, I've been talking today about guidance versus enforcement for travel within Scotland. Clearly there are issues of travel between all of the four nations right now, particularly Wales, England and Scotland. And these are the kind of issues that, yes, we need to be able to come together and try to reach sensible agreements on. And hopefully we can do that. But I am responsible for the decisions I take and for the consequences of those decisions. And I think that's what people want me to continue to focus on. And that's what I will try to do to the very best of my ability. Joseph Gartley from Bauer.
Thank you, First Minister. This morning, West FM is hearing about supermarkets in Ayrshire where workers have contracted the virus. How concerning is this, given the high volumes of people visiting supermarkets, and are more restrictions needed?
I don't know the particular supermarkets or cases you're talking about there, but Test and Protect, if cases have been identified, Test and Protect will probably, as we speak, be working around the contact tracing of that to make sure that the appropriate precautions and steps are taken by supermarkets, but also that contacts of any positive cases are identified so the chains of transmission can be broken. Last week we did take the decision, and we didn't take it lightly, to ask retail shops, including supermarkets, to go back to 2 metres physical distancing. We had previously over the summer allowed them to operate at 1 metre physical distancing. We've now asked them to go back to 2 metres. And we've asked supermarkets to reintroduce some of the sensible mitigations they put in place early in the pandemic that some then moved away from over the summer, such as queuing to get in or one-way systems. And so that is a sign that as prevalence of the virus is higher, the risks everywhere are greater. And so the mitigations and the precautions we all take have to be all the more robust. And that includes supermarkets and other shops right now. Phil McDonald from Global.
Afternoon, First Minister. Just looking at Blackpool, of the 180 people, I think it was, you said, of those who tested positive after being there, have any trends been identified? So were these people part of large groups, or was there any particular business or setting linked to these cases? And just given everything you've said today about travel, should people effectively put any plans for a staycation on hold for now?
On the trends, there's no more that I can go into right now. There is, as I said, an incident management team that is specifically looking at cases with an association to Blackpool. I think it's been meeting this morning, and I would expect these numbers to have gone up over the course of the period since I gave these numbers. The trend, the one I can talk about, Fiona may want to say a bit more about travel generally and anything else on Blackpool, but the one trend I can point to, which I already have, is coach parties. Now, again, I need to be, it's a bit like the issue in hospitality. Without complicated scientific genomic sequencing, you can't ever be absolutely certain about exactly where somebody got a virus. So we draw conclusions from the things people see, and we know Blackpool has been a particular factor in recent weeks, and we know within that coach parties to Blackpool have been a particular issue. And in one level that's not surprising. Lots of people from Scotland at this point in the year go to Blackpool, and of them probably quite a substantial proportion go by coach. So these are the things we're saying to people just to be mindful of, and don't go if you don't have to go. And more generally, we thought very carefully last week about when we put the restrictions in place around hospitality and the particular restrictions on the 5 Central Belt Health Board areas of whether to have a mandatory travel restriction. We decided against it at that stage, and we decided not to say to people, if you've got an October break booked, you have to cancel it, to allow people to go, but to be very careful. But if you don't yet have a break booked, or if it is an option not to go, you might not lose money and you can book again for some time later after we're out of this pandemic. Or if you're thinking of travelling for other reasons that are not essential. We are in a global pandemic, and my advice would be to not travel if you don't have to, because then you are minimising the risk of getting the virus in the place you go to, or perhaps inadvertently and unknowingly taking it there or bringing it back with you. So it's just one of the ways in which we can try to minimise the way this virus spreads across the country. So if you don't have to travel right now, don't travel. That's particularly strong advice to people in the 5 Central Belt areas, but it applies more generally. And I'm just asking people to exercise their common sense around that at this moment.
What what we do know, so our incident management teams are gathering intelligence for us, and we're learning every week as we go about where the transmission is likely to have happened. And one of the things that I've observed, and a previous questioner asked about workplaces, is where people are with people they know, they tend to become more relaxed and don't apply facts. They don't socially distance. They perhaps are not as vigilant about their hand hygiene. Perhaps they'll not be wearing face coverings if they're either travelling together or if they're within the same home or if they're socialising with each other. I think the other aspect, I spoke earlier about the winter vomiting bug. Within 2 days, and sometimes shorter, you will know, because you'll be having diarrhoea and vomiting, that you are unwell. The challenge for us with COVID is it is often not obvious that you have COVID until you have then been in another area, perhaps gone from an area of high transmission where you're more likely as a member of the community to have it, to a more rural area where you've perhaps then transmitted that virus to other people unknowingly and unwittingly. And therefore, the risk is much greater because we're not always confident about managing to keep people in self-isolation before they actually then have symptoms. So when people are travelling from high to low, they may do so without symptoms. And some of our incident management teams have also suggested that some people are travelling with symptoms. So again, we would urge you, if you're feeling at all unwell, think through high temperature, cough, loss of taste or smell, go and book a test. And the minute you have to book a test, you then need to stay at home and wait for that result. So minimising travel, minimising social gatherings, but in particular following the rules of facts will protect you and will protect the wider community.
Thanks, Fiona. Paul Smith from Central FM.
Good afternoon, First Minister. You're probably aware there was an anti-mask demo outside Parliament over the weekend. That was attended by a number of people, including a Clackmannanshire Council teacher. Do you think he acted irresponsibly by going? And what message do you think that sends to his pupils? And secondly, if I may, you talked about the old firm game and people travelling across the border. Would you maybe encourage bars and social clubs in England not to show the Rangers-Celtic game to maybe reduce the risk of people travelling to England?
I think I'll probably restrict my advice to people travelling from Scotland to there. I know the police and venues in parts of England where people might want to go will also be, making sure that the rules are complied with. But there's it's not easy. I don't want to minimise the disruption to everybody's lives just now by saying it's easy. None of this is easy. And for people whose enjoyment, and there are very many of us in Scotland who comes from watching their football team, my dad is one of them, then this is another aspect of how tough life is right now. So it's minimising it for me to say it's easy. But the important way and the best way of avoiding any of the kind of implications that you talk about is for people just to stick to the rules here. Don't travel. The reason we're asking people not to go to pubs here is because we want to stop the spread of the virus. It defeats all of that if people just try to go somewhere else to go to the pub, because you could be taking the virus there or you could get it there and bring it back. So please don't do that. And if we all behave responsibly, we'll get through this a lot more quickly and in better shape than we will if we don't all behave responsibly. And I appeal to people, however frustrating and disappointing it is, please follow all of this advice. And the first part of your question, I'm not going to comment on individuals. I hope you don't mind. And I'm certainly not going to comment on any employment aspects of what they might or might not do. More generally, we live in a democracy. People are entitled to protest against government policy and protest against laws that they don't agree with or don't like. I would never ever suggest that people shouldn't have the right to do that. Right now, of course, any protests should be within the rules on public gatherings for public safety reasons. But, I do struggle to understand the anti-mask sort of lobby, if I can call it that. This is something we can all do to help minimise the transmission of the virus. I've said many times before, wearing a mask protects other people from you transmitting the virus to them, and if they're wearing a mask, they protect you from having the virus transmitted to you. And at a time when we're having to do so many unpleasant things, not see our families inside our own homes to try to curb the spread of this virus. It seems to me that asking people to wear a face covering when they're out and about is a relatively small thing to do. I know it's not comfortable. You get used to it. I now, even in this building, coming from my office up the stairs down here every day, wear a face covering when I'm doing that because, I'm helping to protect people around me. So please just do these things. They all add up and make a big difference. And every time somebody doesn't do them, then conversely, you're taking the risk of passing the virus on to somebody else, and you don't know then how vulnerable that person might be. Neil Pooran from PA.
Thanks, First Minister. If I could first of all get your reaction to Keir Starmer's proposal last night for a national circuit breaker style lockdown. How would such a proposal fit into the strategic framework which you're working on just now? And on travel, would it not give people a bit more clarity if the rules were put into law, as I think Mark Drakeford suggested he might do in the future if there can't be a four nations agreement on it?
We don't rule out putting things into law. The point I'm making on travel is even if you put it into law, given that the police can't be, everywhere all of the time, stopping every, person travelling, it still depends on people respecting and doing what has been asked of them. And let's not wait or say that has to depend on it being in law. Let's do these things now for the right reasons. But I don't rule anything out if it is required to keep people safe. On Keir Starmer's comments yesterday, I would say sometimes I think the circuit breaker terminology gets in the way of the substance of what we're doing right now, because different people seem to mean different things by it. If I looked at the detail of what Keir Starmer seemed to be suggesting for England yesterday, most of it we are doing currently in Scotland across the whole country in relation to household restrictions, and in the Central Belt in relation to hospitality, although we have restrictions of some degree on hospitality right across the country. And our schools are over last week, this week and next week. Some of our schools will be on holiday throughout that period. So we appear to be in Scotland doing most of the things that Keir Starmer was describing as a circuit breaker. I am open, very open, and we'll make this clear to the Prime Minister later, as Mark Drakeford has done, that I think it would be helpful to have some Four Nations discussion in a COBRA context this week, actually. It would be helpful to see if there are more things we should all be doing right now, and see if we can get agreement. But as I've said many times and will continue to demonstrate, I will do the things that I think are required here, if I think they are required, and not wait for others to act. That's what we did last week with hospitality. Took a lot of flack for it, understandably, in a democracy, but I think it is right that we act quickly when we think there is a necessity to do so. Conor Matchett from the Scotsman.
Thank you, First Minister. Just on that point, could you give us a bit more detail about more of the things maybe should be done? And if I may, just secondly, Dr. Donald McCaskill from the Scottish Care this morning described the testing strategy review that's going on as potentially taking until mid or late November for tests that are currently in NHS Nightingale labs to move to regional labs. I'm wondering if that means that we're facing more of the restrictions for longer than are currently in place, and secondly, whether or not the testing strategy that's been in place over the last few months ahead of this spike has actually been working properly.
My apologies, Conor, you were breaking up quite a bit there, so I think I got the gist of your questions, but if I'm answering a question that you didn't ask, that's the reason for it. I'll hand over to Fiona as well on care home testing in a second. I think the first thing you asked me was, I think from what I could hear, to give examples of the further things we might do if we think it is necessary. I'm not going to start to speculate, but it's pretty obvious. We have tougher restrictions in place in the Central Belt. One of the things we will always have to keep under review is if there is a need to extend those tougher restrictions to other parts of Scotland, or indeed if there is a need to do any more than we are currently even doing in the Central Belt. That's not to say we are going to do these things because we haven't taken decisions, but we will continue to monitor how the virus is behaving and not shy away from taking decisions if we need to. Any decision we take right now to try to control the virus will not be popular and will be unwelcome. But I think the majority of people know that sometimes these things are necessary, and it's better to take tough action quickly than to prevaricate and hedge your bets about that and then find that by the time you have to take the action, you've got a much bigger problem to try to get on top of. So we will try to strike these balances as well as we can. On care home testing, this is where you were particularly breaking up. We are in the process right now of transferring care home staff testing from the Lighthouse Lab network to NHS Scotland. It is a process that will take some time to complete, but I didn't have these figures in front of me yesterday. I can't recall if it was you that was asking yesterday, but as of the end of this week, we will have transferred almost 30% from Lighthouse to NHS Scotland, and that will continue to increase in the weeks to come, and we anticipate right now that by December all of that testing will have transferred over from Lighthouse to the NHS. Now the proportion of tests that are still being done in the Lighthouse lab, of course, that doesn't mean we don't continue to work hard to make sure they're being turned around as quickly as they need to be, but we want to get them over to the NHS in order to give us more control over the turnaround times. And the refresh or the updating of our testing strategy, I will report back on that after Parliament goes back after the October break. One of the things, as I said yesterday, although we haven't finalised decisions, that we are looking at in that context is extending routine testing into more groups of people that interact with care homes, and one obvious group would be people who regularly visit care homes to see loved ones within them. But I will report back on the conclusions we've reached on that in just under 2 weeks' time. Fiona, do you want to add on care homes?
And I think the care home testing regime has had some hiccups in it, but on the whole, we've seen great success there in terms of that routine, regular testing. As I said earlier, when we have increased community transmission, there is that risk then that can be taken into institutions such as care homes. So all staff within care homes have the right level of PPE, good infection prevention and control. So the minimising of any transmission is already there, and our care home staff are working tirelessly to do that. We have picked up positive cases within our staff, so the care home testing of staff has been of value because we've had early intervention. Again, I've said about lack of symptoms, often whether it's for elderly residents or for staff themselves. So that routine testing has alerted us to areas where either staff or some residents have had positive tests, and that then has allowed incident management team, problem assessment group and the care home themselves to take additional steps to protect further residents. So I think the testing programme has been working. Nothing is perfect, and we're continue to make these improvements, and I think showing our commitment to make sure that we as far as possible keep our care home residents safe.
Thanks. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. Some of the figures that you read out earlier on, the ICU admissions figure, I think, is the highest on an individual day since the 7th of April. Are we now at a similar level of risk of the NHS being overwhelmed as we were back at the height of lockdown? And to what extent is that going to influence some of the decisions you're making in the days ahead?
The NHS is very well prepared, and we prepared it well earlier in the year going into the peak in the spring, but if anything it is better prepared now. It's got greater contingencies. We've got the NHS Louisa Jordan. There are our ICU units are not near capacity. I think we've got in total across Scotland right now, don't quote this exact number, it's an approximate number, around 175 patients in total in ICU beds, and only some of them of course are COVID patients. We have the ability to double and then treble ICU capacity in a fairly short space of time. We have contingency plans within our wider hospital capacity to make sure that we can cope with any increase in demand for COVID. And of course, should we need it, and we hope we wouldn't need it, we've got the NHS Louisa Jordan as well. So, that gives me assurance, but I'm not complacent. We will be monitoring NHS capacity on a daily basis, making sure we're taking all of the required steps, because we don't want our NHS to be under pressure that it would come anywhere close to not being able to cope with, and that's why these things are so important. But the other reason why we don't want to see more people going into hospital and more people going into ICU is not just because of capacity issues in our NHS, it's because the more we have that, then the more people are going to be ill and dying, and that's fundamentally what we want to minimise. So all of the decisions we're taking right now, yes, they are driven by a desire to protect the NHS, and by protect the NHS, what I mean is protect the NHS's ability is to care for everybody who needs its care and to save lives. And this is a moment, and for any journalist that is about to hear this as some kind of criticism of scrutiny, it is really not. I absolutely accept all of the scrutiny that comes. I don't always enjoy it, but I accept it. And all of the detailed questions that I'm asked here day in and day out are all perfectly legitimate. But I would ask everybody at this moment, just, if you cast your mind back over the last week, I've stood here and answered questions on a whole range of things. Football today, last week, the precise definition of a cafe versus a restaurant. All of that's important and legitimate scrutiny. So as I say, I'm not saying it's not. But in the midst of all of that, let's not forget what this is all about. This is about trying to take the decisions that minimise the number of people who will die from this or become seriously ill or live with long-term health conditions. So in the midst of all of this, let's just keep ourselves focused on why we're having to do all of these things and why I have to stand up here and make decisions and communicate decisions that just a year ago I would have never believed that I would ever find myself doing. That's what this is about, and let's not lose sight of that. Tom Peterkin from the P&J.
Good afternoon, First Minister. The NRS figures show that the number of deaths at home are still above the 5-year average, whereas hospital deaths have fallen below the 5-year average. I was wondering, there have been suggestions from experts that this could be down to lack of face-to-face contact with GPs or diagnostic test delays. What do you believe is the explanation for this, and how concerned are you about it?
I'll ask Fiona to say a bit more about this. I'm not going to stand here and speculate about what I believe might be the case, because this is the kind of stuff that's really important that statisticians and analysts and health experts do proper consideration of, so that we can at some point stand up here and say what we actually think is behind this. Of course, the different patterns of care that we've seen over the course of this pandemic will be a factor there, but there may be other factors at play that have to be properly analysed and understood. But I'll ask Fiona to say a bit more.
And throughout all of this, we have urged people who are concerned about symptoms to access their GP. Many have found the new way of working actually to their benefit in terms of getting that same-day callback, same-day consultation. And yes, we have had restrictions on some services, but that's part of our remobilisation till we get back there. Statistics are incredibly helpful. It sometimes takes sometimes months or years to be able to look back and fully understand. But what I would say is if more people are dying at home, it may be because that's their place of death that they wish to die through choice. But also, if someone has not gone to their GP and has gone too late, then often that late presentation of symptoms would take them to hospital. So I do think we have to be very careful about making assumptions, because I would have thought that late presentation would mean hospital admission for treatment rather than actually no presentation at all for people and staying at home without treatment. But I take this opportunity to remind people of accessing, whether it's NHS 24, 111, the GP services, if they have any doubt at all about needing that clinical support and decision making.
Christine Lavelle from The Sun.
Thank you, First Minister. Donald McCaskill of Scottish Care has today warned about patchy access to flu jabs for care home residents because of all of the health boards have their own policies for administering the vaccine. He's suggesting that people are being put at risk by delays, and says lessons have got to be learned quickly ahead of any COVID vaccine becoming available. Is this something that's been raised with the Scottish Government, and how will the delays be addressed in some parts of the country?
Fiona will want to say a bit more about this as well, but we are, the Scottish Government, the Health Secretary and officials are engaging with health boards on an ongoing basis about the administration of the flu vaccine programme. All health boards are working through that. The absolute priority, which everybody takes very seriously, is to get everybody who is eligible vaccinated as quickly as possible. That's our priority every year, even more important this year. And also, and there have been some issues raised around Greater Glasgow and Clyde today, that the priority within that of the order in which people are being vaccinated is appropriate as well. And we engage on an ongoing basis with health boards to make sure any concerns are being addressed and any issues being properly resolved. I get, as I do on many things just now, I get emails and contacts from some people who, because it's a new way of administering the flu vaccine this year, have said that they've not found it as easy, and we try to address these issues with health boards. I've also had a quite high number of people contacting me over the past few weeks saying that they've had their vaccine in a community hall or a school, and it's all gone really well. So it's absolutely essential that the programme works well this year, and that's why we will take on any issues with health boards that arise to make sure that all of the people who are eligible get vaccinated.
And people probably know by now that actually the routine and typical way of administering flu vaccine this year has changed. So what I would urge is care home managers to link with their local healthcare settings so that that system and programme of administration of the flu vaccine can take place. The absolute commitment, the reason people are in care homes and the reason we've actually put so many restrictions in care homes is that people over 65 with predisposing conditions are at their most vulnerable. So it's just these residents that we would expect to be in the first group of people who are vaccinated, and that ongoing dialogue we have every day with boards about sufficient supply, how are people getting on with it, is something that we take incredibly serious, and we want to see that first group of people vaccinated so we can move on to other cohorts. People are doing things differently, so in previous years it would probably have been through the GP practice. Health boards, for their individual circumstances, are making their own arrangements. But what I do know from talking to board nurse directors and from nurses on the ground who are administering the vaccines, that we've had an incredibly high uptake, which is very, very positive. But we are continuing to press boards to make sure that the most vulnerable in the age groups and those with predisposing conditions get access as early as possible and as quickly as possible. And we will continue putting that dialogue there and encouraging boards to deliver a safe and effective system of flu vaccination.
Tom Martin from the Express.
Hi, thank you, First Minister. Just returning to the issue of travel, obviously you've raised concerns around the high numbers coming back from Blackpool, but out of the sort of 344, I think that you mentioned in the past week, are there any other, what other specific areas are causing concerns with numbers?
They'll be spread across different places. The reason I'm specifically mentioning Blackpool is because that is pronounced, and if any other area becomes pronounced, I will mention it as well. What we would say, and I did say earlier on, is the areas that are of England that are in the high or very high tiers there, we're advising not to travel to. Now, I appreciate that's difficult to be certain about because these areas perfectly legitimately will change, and we'll keep that updated as we can on the Scottish Government website. But when there is a particular place that is giving us a particular cause for concern, we will mention it, and that's what we've done with Blackpool today. Simon Johnson from the Telegraph.
Good afternoon, First Minister. Just in terms of extending the use of face coverings, Sage advice published 2 days ago said wearing face coverings outdoors would have, quote, a very low impact on community transmission. And I just wondered if you could rule that out. And on Keir Starmer's suggestion of a circuit breaker in England, do you think that would be helpful in terms of reducing the cross-border transmission that you've highlighted in terms of Blackpool in your opening remarks? And also in terms of having a more consistent four nations approach? Obviously, you've announced a circuit breaker here. Arlene Foster has in Northern Ireland, and you think it would be helpful in terms of that as well? Thank you.
Look, everybody has to take their own decisions. I'm responsible for the decisions I take here. We will continue to keep all of our restrictions under review, and if we feel we need to go further, we will. I think all parts of the UK have a rising challenge right now, and therefore I think action is essential across the UK, as is having a sensible agreement about how we restrict travel from low to high prevalence areas or vice versa, which is why I support Mark Drakeford's call to have discussions on that. And, you know, as I said earlier on about Keir Starmer's call, most of what he seems to be suggesting for England, not all of it, we are doing in Scotland and particularly in the Central Belt. If we feel we need to go further than that, as I say, we will do that. On face coverings, we'll update the regulations and face coverings tomorrow, and I'll say more about this tomorrow. As I said in Parliament last week, we are looking to extend, particularly in certain indoor areas. So, you know, like I've just said, in the Scottish Government headquarters, which you'll be able to visualise and most people won't, you know, when I'm coming from one floor to do this press briefing, I'm now wearing a face covering, and the regulations will cover communal corridors in workplaces, and also things like staff canteens, which have been exempt up until now, even although there is a requirement in hospitality more generally. I'm not going to rule anything out with the greatest of respect, because I don't think in a situation like this we should. And what you said there is, I'm not going to gainsay the scientists who know much more about this than I do, but in a pandemic where we're trying everything we can to get transmission under control, low impact is maybe not as good as high impact, but it's better than no impact. So anything that we might think can make a contribution to this massive effort to keep the virus under control, we will consider. And it would be, I think, rash and wrong to rule anything out categorically at this stage. But we'll make these decisions on a considered basis and in a balanced way, which is what we try to do with everything. Helen McCardle from the Herald is the final question.
Hi, afternoon, First Minister. I wanted to ask yourself and the Chief Medical Officers and the Cabinet Secretary have repeatedly stressed the importance of getting the flu vaccine this winter. As we reported in the Herald this morning, some older people are waiting to get it, are waiting longer than ever before to get the jab. NHS Greater Glasgow and Clyde has opted to use a childhood vaccination system, which means that it goes in order of age from youngest to oldest. So over 65s will be invited first, working up through to people in their 70s, 80s and 90s. So you end up with a situation where potentially people in their 90s aren't going to get their jab until the end of November, possibly even into December, I've been told. They're not the only health board that's using this system. And there's also no way in this system to prioritise people within that over 65 age group who have underlying conditions. So I wanted to ask you, is this system good enough? And if not, what's the Scottish Government going to do about it? And just to tie in with it, given that this is the first year where we've had health boards in control of the system, do you regret the decision in the 2018 BME GP contract to transfer the responsibility for vaccinations from general practice to health boards?
No, I don't regret that, but we are in a particularly unique situation this year where we can't do flu vaccination in the normal way for reasons about controlling COVID, so health boards are putting and have put alternative arrangements in place. We have quite substantially covered some of the content of your question, but we'll go through some of it again. The system that Greater Glasgow and Clyde is using, and you're right, other health boards, not all health boards as I understand it, but others are using, is the child immunisation system. It is an NSS system. I think there's two things to be very clear about here, but before I'm clear about them, the Health Secretary and officials are engaging, particularly with Greater Glasgow and Clyde, to make sure that the right priority is given within the overall vaccination programme. But the most important thing here is that all people who need the flu vaccine and are eligible for it will get vaccinated within the timeframes required. That's the most important thing. But within that, yes, we want to make sure that there is the right priority of access. And that's the discussions we'll continue to have with health boards. But but that shouldn't take away from the fact that everybody will get the vaccine, and in a Greater Glasgow and Clyde context, that's not far short of 500,000 people that will be vaccinated for flu over this period. But I'll hand over to the Chief Nursing Officer.
And clearly in the conversations that we're having with Glasgow and with other boards, it will be to agree that the most vulnerable should be vaccinated as early as possible. We clearly don't want to disrupt other arrangements that we have in place, but that will be the dialogue to make sure that the oldest, the frailest and those with predisposing conditions would be vaccinated earlier than others who are not in that category. We're confident that absolutely all of our boards are fully committed to making sure that everyone who needs the vaccine will get it as efficiently as possible. And it's perhaps not surprising that there have been some hiccups in this year, because it's the biggest programme we've expected to deliver. And we're confident that the changes will be made and the older people who are more vulnerable will start to get immunised as soon as possible.
That concludes today's... oh, sorry, I am being told that we have another. They're not on my list, so it's not that it matters, but I'm just saying it's not my fault I've forgotten them because they're not on my list. But anyway, the times are apparently on the line, so I'm not sure who it is. Do we know? Helen Puttock, I think, from the Times is on the line. My apologies, Helen, that I've missed you. Helen, can you hear us?
Yes, I can hear you. Can you hear me?
No. Yeah, I can obviously hear you a little bit because I heard you ask that, but you're very, very faint.
Dan, can you help?
I can't really make...
Hello, can you hear me? Can you hear me?
Nope.
Why can't they hear me? Okay, I wanted to ask about the SAGE minutes. Can you hear me now?
You're very, very faint. Try and I'll see if I can get the gist of it.
So I was going to ask about the minutes of the SAGE meeting on the 21st of September, which clearly give detail of what they believe the next step should be to control the pandemic. The minutes of Scottish SAGE, which are published on the Scottish Government website, are just a 210-word general summary. We don't get nearly the same level of detail. And so I wondered if you could tell us, did Scottish SAGE contribute to the decisions taken last week? And can we see the evidence of their contribution with the same level of transparency as you can south of the border?
I'll take away the point about what more information we can make available from the Chief Medical Officer's advisory group in Scotland. We don't call it Scottish SAGE. And Gregor, the CMO yesterday, went through at yesterday's briefing his input into SAGE and how SAGE discusses these things, takes its decision and then communicates a consensus opinion. We try to be as upfront and open about our advice and our decisions as possible. I stand here every day, which doesn't happen in all other parts of the UK, sharing, and I'm sort of joined by clinicians when I do so, but we'll take away the point about what further information of the CMO advisory group's deliberations we can make available. That does, I believe, conclude the questions for today. Thank you to Yvonne for our BSL interpretation. Thanks to the Chief Nursing Officer for helping me with the questions today, and thanks to all of the journalists for joining and putting their questions to us. To conclude, to all of you, I was pretty blunt in my opening remarks because we are at a really critical juncture again. Many countries are likewise, and you only have to go onto the internet and Google this to see so many countries across the world are now dealing with a second wave, imposing restrictions to try to get it under control. And none of that is welcome, but in a global pandemic, there is a degree of inevitability to this. We all have to act collectively to get this virus under control. We try to communicate what we're asking you to do as clearly and as simply as possible, but I know 7-8 months on, it all starts to feel very difficult and complicated. So effectively, just to summarise and ask everybody right now, try to limit as much as possible the people from other households that you are interacting with. You shouldn't have them in your own home at all. You shouldn't go into anybody else's home. You should work from home if you can, but generally, please limit your interactions. The interactions you do have, try to have them outdoors as much as possible. I know that is not an easy thing to ask of you as we head into a Scottish winter, but get your big coats and jackets on and see a member of your extended family or a friend outdoors, maintaining physical distance as you do. And for other interactions, it is probably the time where we all have to fire up Zoom and FaceTime a bit more. This is really difficult for all of us, but it is really, really essential. The numbers that I am now having to stand here and read out again every single day are grim. They are not easy to communicate, and I am sure they are even harder for people to hear. But a point we learned over the summer, and we need to bear in mind and learn again, is that we can all make a difference to these numbers. We're not powerless in the face of this virus, but it means that all of us have to abide by all of the rules and restrictions that are in place right now. So that is my plea to you at this very, very critical moment in our journey through this pandemic. We must all stick to these rules. It's not easy, it's not pleasant, it's not enjoyable, but it is absolutely essential to protect the NHS and to save lives. So please continue to do that. You have my eternal appreciation for all the sacrifices you're making so far, and I have to ask you to do it for a bit longer. As I said earlier on, I will join you from, here actually tomorrow, but it will be a statement to the Scottish Parliament in virtual session, and no doubt somebody will be helping me through it, and you will be able to watch it at home, but in a slightly different format from normal. I'll be back here later in the week to give you the next update. But for now, thanks very much for joining us.